So you mentioned that the typical patient you see has maybe lost one or two teeth, but some of your patients require a lot more than that. So can you explain what options your patients have?
Sure. So let's say we've got a patient who's already lost all their teeth. The first option would be a denture,
Okay.
Upper and lower denture. It does all right. We've got our pros and cons with the denture. We can, at least you've got some teeth, but the cons of that are that maybe they don't fit very well, maybe they're painful, maybe you don't like the fact that you have to take them in and out every night.
My grandmother had dentures and they broke on her.
Absolutely, dentures can break all the time, so they may need to be remade many times, which that cost adds up.
And you mentioned that you've got to get them redone, like you've got to do them over and over again?
That's right, and the reason that you have to make them again is because a denture may stop fitting after a while, and it'll stop fitting because of bone loss. Dentures can cause bone loss if you have no teeth. So we're able to remedy that by utilizing implants. If we place implants, we can attach those dentures to those implants so that they stay better, they're more comfortable, we get less bone loss.
That's like option 2.
That's right, that's option 2, that's the next level up.
So what's your chewing ability with that? Because I know that my grandma, she had difficulty chewing things with her dentures.
That's a great question. Your chewing force, let's start back at the regular denture, you're only looking at like 10% of your chewing function. Yes, and with the dentures that snap onto implants, maybe we're looking at that 30 to 40% range. And so I know we've limited the amount of bone loss that we can get by adding those implants, but with a snap-on denture, you can still get bone loss. It's not eliminated. So that's when we get to our next tier up. The best option, honestly, is the all-on-4, all-on-6. I'm sure you've heard it called that before, but that's where you place 4 to 6 implants and we make new teeth that are permanently attached to those implants, and you're able to eat whatever you want at that point. You got your 100% chewing function back.
And you don't have to have those remade. They're going to fit.
That's correct.
They're not going to move
That's right.
around on you. You don't have to clean them.
That's
all
right.
Other than brush your teeth, of course, obviously.
Right. That's right, yeah.